Well, thank you very much for joining us this afternoon. We have new information to share with you about the coronavirus pandemic and how it is affecting everyone here in Orange County. We have a lot of information to share with you today, so our list of speakers goes as follows. Orange County Mayor Jerry L. Demings will speak, followed by Dr. Raul Pino, Florida Department of Health, Orange County Administrator, Orange County Sheriff John Mina, Congresswoman Val Demings, Matt Friedman, spokesman for Lynx, Scott Howitt, the Communications Director for Orange County Public Schools. At the conclusion of the speakers, we will entertain questions from you. And now, Mayor Demings.
All right, thank you, Jane, and good afternoon to all of you. Thank you for being here. We wanted to provide the most recent information that we have about the pandemic and its developments here within Orange County. It is not slowing down. Sadly, I have to report to you that here within Orange County, we now have 206 confirmed cases within our county. To put that number into perspective, I want to remind you that just 2 weeks ago, on March the 14th, that was the first day that we had a confirmed case here within Orange County, and we had one. And here we are today, 2 weeks later, and we have 206 cases. Now, because of that is certainly concerning to me. We have a reported number of individuals in our various hospitals totaling about 41 individuals. So we're well within the capacity of our hospitals being able to handle the numbers that we see now. But I want to reiterate that the reason why we put the various measures in place, including the stay-at-home order to the curfew, was that our goal was to slow down the spread of the virus here within this community. So I have to say to our community that we're not there yet. The numbers are increasing daily by about 25% each day. These numbers are likely related to individuals who had contracted the virus prior to the point that we put any of the specific orders in place. So we have a lot of work to do, and so I'm really calling on the members of our community to heed the warnings and the orders that we have put in place to ensure that we're able to help all of us through this crisis. And so it's important that we let you know that our Emergency Operations Center, where you are standing today, we are at level 1, which means that that's the highest level of alertness, and we have representatives from our various local governments and the state partners here operating essentially daily now. I want to again stress to the residents of Orange County that we do want you to stay at home. I've had the privilege of being able to drive throughout the county, and I still see a lot of movement here. While many are heeding the warnings that we have put in place, there are still some who don't quite get it at this point, and we want you to adhere to the various orders that we have put in place. We're encouraging people to certainly participate in exercising and observing social distancing measures. We still, again, have too many people moving throughout the county. The executive order on stay-at-home is in effect until April the 9th. You will begin to see some variable messaging boards around the county that's reminding our residents that we still have that order in place. So I do want you, again, to take the orders seriously. We are working hard to protect you from yourselves. While you are staying at home, if you have questions, we encourage you to utilize the 311 call line. While I know many of you are reaching out to us through social media, I want to take this time to reinforce that we have dedicated county representatives who are bilingual, who are ready to answer any questions by simply dialing 311 here within Orange County. You can also chat with the representative online at ocfl.net /311. There are individuals there who will chat with you online and try to answer your questions. This line is available to Orange County residents Monday through throughout the weekend, actually, and it is primarily active between 7 a.m. and 9 p.m. Dr. Pino is here from the Florida Department of Health, and will give us a clearer picture of what is going on as it relates to the coronavirus numbers. The stay-at-home order has now been in place since Thursday night. We are working to make sure our residents and businesses are fully complying. Sheriff Mina will address that momentarily. We also have representatives from Lynx and the Orlando International Airport who are here who may be able to address any questions concerning the transportation hubs here in our community. We know many businesses, along with our residents, are hurting. I will say to you that I had the opportunity just a few minutes ago to speak with U.S. Senator Rick Scott about the federal assistance, and we're joined today by U.S. Representative Val Demings, who will talk about the $2 trillion stimulus package that includes monies that will include direct checks to Americans and those right here in Orange County, and will also include help for small businesses impacted by COVID-19. Congresswoman Demings will address some of the benefits that will come to Central Florida. And before I introduce Dr. Pino, I want to let the public know that online applications for rental assistance are going well here within this county. We have a team of county employees who have been working since earlier this week, and they'll be working through the foreseeable future. And hopefully you're getting called back when you complete your online applications or engage us that way, or you call the number of the hotline that we have previously published. So at this time, I'm going to ask Dr. Pino from the Florida Department of Health to come forward and give you an update with the most recent information regarding this pandemic. Dr. Pino.
Thank you, Mayor Demings. As the mayor said, we have reached over 200 cases, 206, and we also have our first infant affected by the virus. So to those parents who probably are scared today, it's just him there. Everything will be fine. We have excellent care in Orange County. We will pull it together. The median age continues to be 47 years old for those, and 43 people have required hospitalization, and we have 4 deaths. That has not changed since we talked to you last. The health department continues to do testing at our site in the Alafaya Trail area. We have conducted more than 100 this week. It continues to be a low number. I know that we have to increase our numbers, but we are going to get there. We have issues, as I explained to you before, with the supply. So we decided to assemble our own kits. And yesterday we assembled 200 collection kits that will be used during this week. And that is with addition to 100 test kits that we received from Seminole County that donated to us. And thanks to Dana Walsh, the Director of Health in that department, who donated the kits to us. I also want to reiterate the message that the mayor was delivering to you, that in this time of crisis, we are here to support you. Our WIC office will continue to be open. We are going to reduce from 8 sites to 5, but those 5 sites will be open and providing the services. And remember, if you are pregnant, if you have a baby that is younger than 6 years old, you may qualify for WIC. And we provide services, we provide food, and we provide you with the services that you need. For WIC, you can call 407-858-1494. Again, for the WIC program, 407-858-1494. And also, our calling center continues to be open. We responded about 1,000 calls yesterday. And the number for the center is 407-723-5004. Thank you. Oh, I would like to introduce Sheriff Mina.
Thank you, Dr. Pino, and good afternoon. And so I wanted to take some time to reinforce our message about the stay-at-home order. If you don't need to be out, we want you to stay home. If you're not essential business, if you're not coming from or going to work, we want you to stay home. Something that can identify you as an employee, such as an ID card, access card, business card, pay stub, or even a letter is helpful, but that is not mandatory. Again, we're going to give the benefit of the doubt to our residents, but we want you to adhere to the order and stay home. And, I want to reiterate, the goal of this is to not make arrests, but we will enforce the order to keep our community safe and stop the spread of this virus. We will enforce that order, and we have done so several times throughout the past couple of days. We responded to a large party of about 30 people in a warehouse and had to disperse them. We've also responded to a number of businesses who are not essential and were in violation of the order, and they were forced to shut down when we responded. But remember, every time that one of our deputies or one of our local law enforcement officers from one of the municipalities has to respond to a call like that, you could be spreading the virus even more, or taking that deputy sheriff or officer from another call from someone who needs help. So we want you to adhere to the order, and I think for the most part, everyone is doing their job to heed the executive order, but we need to do better. We need to do better for our friends. We need to do better for our families. We need to do better for our entire community, and that's why we want you to heed the executive order and only go out if you're going to get exercise, get groceries, you're getting prescriptions, or you are an essential business or coming to and from work from that essential business. Please adhere to the orders. So this time it's my pleasure to introduce Congresswoman Val Demings. Thank you.
Thank you so much, Sheriff Meaner. Thank you, Mayor, and to all of the people here. It's good to be home. I just got back this morning, and I always feel like I have the home court advantage when I'm here with the professionals in my community. I believe our job in Congress, as members of Congress, is to bear any burden and pay any price to protect the American people. We're in a place that we have never been before. We're seeing some things we have never seen before as a nation, and therefore we must do some things that we have never done before. On yesterday, the U.S. House passed and the President signed into law a $2.2 trillion relief package. Now, that's a lot of money. It's a lot of money, but when you think about this virus that has touched all 50 states, I was on a conference call with FEMA the other day, and they likened it to, imagine if there was a natural disaster, that we know what a storm can do to one state or a region, but imagine if there was a hurricane in all 50 states. But this virus has touched all 50 states. We know certainly what it's done to our home state of Florida, and we've heard the impact that it's having here at home. And when you think about all of that, $2.2 trillion is simply not enough. It's not enough money to get us where we need to go, where I know we will eventually go, but I can tell you that it is a significant beginning. I just feel compelled to say this as we go through this time of uncertainty and fear and not really knowing how quickly we are going to recover. America is a great nation. It is a great nation, but we're a great nation because of the people who go to work every day, people who have to go to work every day. So one of the things that we wanted to make sure of in this relief package is that we put people first. It is people first legislation. I'm so proud to say that. It's not a stimulus package. When you think about a stimulus bill, it's really about encouraging people to go out and spend money. This emergency relief package is really about helping people to survival. As the mayor has said, we are trying to get cash, and, there's been a lot of debate about that, but people are suffering in a short period of time, and so we're trying to get cash into the pockets and hands of people, those people who have to go to work every day to survive as quickly as possible. So there will be direct cash payments to those individuals who make less than $75,000. For a couple who makes less than $150,000, there will be a $2,400 direct cash payment and a $500 payment for each child. If you have filed your 2018 or 2019 tax return, the system will be, we will look at those who have filed tax returns, and some may say, well, everybody doesn't file a tax return. We know that there are a lot of individuals who don't make enough money to file a tax return. We're working through that. But the quickest way to get this done is to look at those who have filed tax returns, those who have Social Security numbers, and also those individuals who receive Social Security. If you fall within that income threshold, then you will receive a check as well. This piece of legislation also basically puts unemployment benefits on steroids. If you unfortunately have been laid off, then we want to make sure that you are able to survive. So in addition to the unemployment benefits that you would receive from the state, we're looking to give each person who finds themselves in that category a additional $600 payment. Small businesses, we say all the time that small businesses are the backbone of our community. They are. And we want to make sure that small businesses are able to make it through this tough time. So a significant, about $377 billion are designated for loans to small businesses. Now, the idea, what we are hoping, is that those small businesses will be able to retain at least 90% of their employees. The focus, again, is on people first. And if these loans will also help small businesses for the first time be able to pay their mortgage, their rent, their utilities. And we're hoping that in the end, and we're hoping the end is in near sight, that if they're able to retain at least 90% of their employees, then those loans will receive 100% loan forgiveness. In addition, we also have designated $500 billion to our corporate loan program. I know, too, that corporate businesses are hurting. I came through the airport. I have been there twice in the last 48 hours. And a lot of the businesses, we know what community we live in. They employ a lot of the people that we are trying desperately to take care of. And so there are $500 billion that have been designated to the corporate program. However, there are some conditions to make sure that they, too, are able to pay payroll, that the large majority of the money will go directly to the employees. There are also some other conditions that I won't get into today, but we want to make sure that the money is spent appropriately. And, you know, sometimes I know we have a lot of good actors in this community because we've been through tough times before. Many communities do not. We are going to commission a 5-person panel that will oversee this particular program to make sure those funds will be spent as they are intended. There's money there, funds there for student loans, those who have federal student loans. There's money there for them. We're suspending wage garnishment and negative credit ratings during this time. There's money there to enhance medical services for our veterans, for our hospitals. You know, one of my biggest fears is hospitals being able to meet capacity. You hear the numbers are going up. They're not just going up here, but they're going up all over the country, and that is one of the main concerns, is that they'll be able to meet capacity, but also that they will be able to acquire the emergency equipment and personal safety equipment that they need. I was just touched by the U.S. NS going out, naval ship going out today, headed to New York, providing 1,000 beds, not necessarily to deal with coronavirus patients, but to take on other triage patients to free up beds within the hospitals for those coronavirus patients. Just very quickly, there's funding there for state and local governments, transit, food security, housing, for our homelessness. There's been a lot of discussion about what happens to the homelessness. So there's funding there for the homelessness or those who are at risk of being homeless. Rental assistance, there's a moratorium on evictions and foreclosures For those persons who, those properties that receive federal assistance, there are additional funding for our seniors, additional funding to mitigate the spread of corona in nursing homes. These are just of a few of the items that this 1,200-page piece of legislation entails. There's certainly more to follow. As I said, it's not enough. It is simply the beginning. We expect the next package and the next package as well. But I do want to take this opportunity to thank you again for helping us to get our message out to the people who desperately need this information. And thank you again, hometown team, for the exceptional work that you are doing here. I just want to quickly, before I introduce Mr. Freeman, to let you know that the President has authorized the Defense Production Act. It took a little while, but he has recently authorized that to make sure that private entities are assisting in the emergency equipment that is needed for our healthcare professionals. And at this time, I'd like to introduce Mr. Max Friedman from Links. Thank you all.
Thank you, Congresswoman, for everything you're doing up there in D.C., for the local residents here in Central Florida, and especially the transit industry, because we really do need your support right now, so thank you. And also thank you to the media and folks watching at home. Yesterday afternoon, we announced that on Monday, March 30th, that we will be curtailing some of our services and going to what we call a modified service schedule. We are an essential service here in Central Florida, and we believe in continuously moving essential workers. Now, this allows us, by making this change on Monday, to fall in line with the stay-at-home order. But most importantly, it's providing access and giving people the opportunities to go where they need to go for when they need essential services. Now, the full modified schedule is available at golinks.com/coronavirus info. Again, that's golinks.com/coronavirus info. Our team has been hard at work putting together this page so folks can see what the schedules are going to look like going forward, I should say, until further notice. Now, we are asking customers, if you're sick, please stay at home. Again, if you're sick, please stay at home. Essential travel only, and that falls in line with the orders that have gone out throughout Central Florida. Operationally, we've been strategic and efficient and effectively disinfecting our buses and our facilities for our employees and for you, our customers, because we do not want this to infiltrate our system, and we believe what we're doing has been safe for everyone. Again, I want to leave you with, if you are looking for information about what we are doing, everything is housed on golinks.com/coronavirus info. Thank you.
On behalf of Dr. Barbara Jenkins and the school board, I want to remind all Orange County Public School parents and students that distance learning begins on Monday, March 30th. If any parent has not heard from their child's teacher at this point, please contact the school using the general email address at the bottom of the school website, or you can contact the school via phone during the operating hours between 9 a.m. and 2 p.m. on Monday. We want to thank our parents for their support as we begin distance learning. We want to thank our teachers for their tremendous efforts to ensure our children are able to successfully continue their education from home. Our grab-and-go free meal program has been extremely successful. We have provided more than 200,000 meals for more than 100,000 children throughout our community at 50 sites over the last week. Some adjustments will be made next week to ensure that we are providing additional meals to as many children as possible. We will be opening new sites and handing out flyers starting on Monday to parents at the sites that will be consolidated. Changes in the grab-and-go sites will not go into effect until April 1st. The times for our meal distribution will be from 10 a.m. to 1 p.m. Parents can check the OCPS website, ocps.net, for locations. I want to thank our food and nutrition services staff who have worked so hard to meet the needs of so many children in our community, as well as our volunteers that will continue to make it happen for them. We want to send wishes to our families to stay safe and healthy during this challenging time for all of us. Thank you.
Okay, at this point, you've heard from our various community partners as we collectively respond to the pandemic, and we'll open it up for any questions that you may have. Okay.
Hi there, Eric Sandoval with Channel 6 and ClickOrlando.com. I think this is a question for actually Dr. Pino, if you don't mind. Just within the last hour or so, Governor DeSantis announced that he has secured more hydroxychloroquine to be sent to Florida, and he's distributing it to key areas in the state, and he listed Orlando as one of those key areas. Do you have any idea on how that's going to be distributed here?
No.
Simple no. Are you in the process of figuring that out? Is it going to your agency, or is it who's managing that?
I don't know. I just heard the news from you, so I can't really know.
Okay.
I would probably receive guidance on that matter.
Okay. And maybe a follow-up question really quickly. The mayor said that there were 41 in the hospital. Is that 41 people that are hospitalized right now?
I believe 43 has been hospitalized so far.
So far, so not right now in the hospital necessarily.
I will not be able to tell you if that's right now.
Okay.
Yeah.
Thank you.
Yes, please, for Dr. Pino. You mentioned that an infant was tested positive with the COVID-19. Can you provide more details about the child and the family? Are other members of the family infected, and so on?
We don't provide information on children. That's all that I can say. 11 months old.
11 months.
Yeah.
Kelsey.
Hi, Kelsey Thord with West 2 News. My question is also for Dr. Pino. Could you talk a little bit more about the testing that you're doing here in Orange County? I know you said you put together about 200 test kits that the county has been doing, but the governor keeps saying that they're shipping test kits out to different areas. Have you gotten any test kits from the state?
Yes, 150 3-4 days ago, and we got 200 more tubes for the. So let me explain this so that you understand. The test kit has two components: the solution where you put the material to test for the generics of the virus, so you are looking for the genetic material of the virus, and then the swab. But the swab has to be a specific swab. It has to be flexible, and it cannot be made out of cotton because it contaminates the sample. So swabs are coming from one direction, tubes are coming from another direction. Sometimes we have to match it. So in that case, we also received 200 tubes from the state, but we don't have the swabs for those yet.
And just to follow up on that, I know you've said when we held this press conference last weekend that you were hoping to crank out 100 tests a day at those sites, but you don't have enough tests to do that. I mean, how many tests do you think that you should be getting?
So I don't know. It depends. So I could open with the help of the county a drive-through testing, and we can do thousands. But you have to have the supply. Another limitation that we have is the strict criteria for those who can be tested by the state. Private practice can test anyone. They don't have to have any symptoms. They just need a prescription from a doctor, have insurance, and they get to one of the public labs. But in our case, the criteria is very restricted. I want to encourage people, and thanks for giving this opportunity, to call us and to come for testing. We actually have a space. So the convention center has more space for testing. Because of the criteria, we have to screen out a few people, but we need to test more people, and we have sufficient to continue for this coming week.
Are you hopeful that that criteria will change in the near future, or do you think it's still going to be that 65 plus with symptoms or first responders, medical professionals?
So in a pandemic environment, sometimes testing become obsolete and not necessarily the tool to use, and sometimes in the future, we may move the testing just to clinical settings where it makes a difference in the treatment that you choose for a specific patient. What we have said to the public, the safest way to go right now is to assume that you can acquire this from anyone. That would be the best way to protect yourself.
One more question for Dr. Pino, please, over here. Hi, Dr. Pino. Justin Soto with Spectrum News 13. With the first case of an infant here in Orange County with the coronavirus, what does that tell you about the virus? And do you believe children might have a harder time recovering because their immune systems might not be fully developed?
I cannot answer the last question. That will be really for an infectious disease doctor who specializes in immunology. I don't know the answer to that one, to be honest with you. It's true for older adults, where the immune system start debilitating as we grow older, and they have no ability to respond as quicker as we could, younger and healthier individuals. For babies, I don't know the answer to that one. It probably depends on what age and what kind of immunity they are receiving from the mother. Are they breastfeeding? So many things go there. And you have another question, but
Yeah, one more thing I wanted to ask. Of course, we're continuing to see cases grow here in Orange County and other parts of the country. How do you know when we've reached the peak of the virus and any peak in sight?
You will not know the peak until you start coming down. So that's the interesting an epidemic. It continues to go up and up and up, and you watch it statistically, and at some point, it will come down natural distribution. And that's why many people at the national level have talking about flattening the curve. How can we take steps right now to get to a point that is not as high as it should be without those measures in place? But to your first question, the indication that we are receiving from Washington data is that the epidemic is changing. I talked about this maybe in our last press conference, where we don't see that many cases coming from external, but more for community distribution and transmission locally.
Another question, Eric Sandoval, Channel 6 again for Sheriff Mina. You mentioned, you cracked down on some large parties and one business that was sort of deemed non-essential. Can you give us an idea of what kind of business that your deputies responded to?
There were two businesses open that are basically arts and crafts chains. They got some messaging from their corporate offices to stay open. We were able to work with their corporate offices and ensure that they were shut down, but definitely not essential according to the order that's in place.
Edgar Carrillo de Telemundo, una pregunta en español para el doctor. Quisiéramos tener más información sobre ese medicamento que mencionó el gobernador de Santis, cómo actúa, cómo está compuesto, en general, más detalles de este hydroxychloroquine.
Es un medicamento que se usa normalmente en el tratamiento de la malaria y ha habido algunos resultados en el exterior. Algunos científicos consideran que los resultados no son tan importantes como para aplicar el medicamento, que también tiene efectos secundarios importantes. Pero en un estudio, creo que en Francia hicieron recientemente, aunque hubo un número limitado de casos, se piensa que puede tener algún efecto. Y entonces es como tratando de encontrar, son medicamentos que ya están aprobados para el uso en humanos, la utilización puede ser efectiva muy rápidamente.
Okay, this is Kelsey Thord with West 2 News again. I don't know if Mayor Demings, you would have this answer, or airport official. What's kind of the status right now at OIA with all of the TSA officers that have tested positive? And then the Governor DeSantis, just talked a little bit ago about how he wants to stop flights from New York, Louisiana, New Jersey, that area. He said he doesn't have the power, but he seems to be pushing for those flights to be canceled coming into Florida. Have you guys talked about that? And is that something that we can do here at Orlando International?
We're having conversations with our federal authorities, and for the most part, the airports are governed by the federal government and the FAA. I will ask the executive director, Mr. Phil Brown, from the airport to come forward, and he can share with you what he's seeing on the ground at the Orlando International Airport with how, at least at this point, they're being impacted by the inbound flights from various places throughout the country. Phil Brown.
Thank you, Mayor. In terms, and I'll answer the TSA officer question, there have been now 7 officers that have tested positive. All are in quarantine. The last 2 officers, 6 and 7, the last day at MCO was on the 13th of March. So it's been a while since they were at work. We continue to rigorously clean. We still have a full staff crew at the airport, even though yesterday we only had 5,500 passengers flying out. In terms of the flights from New York and New Jersey and now Louisiana, they're being processed by Department of Health investigators supported by the National Guard. There are, I think, 11 health officers and 10 National Guard in their contingent. Flights that went out yesterday, or yesterday, 36. When we started this program, there were over 70. There were a little over 1,000 passengers on those. The load factor on those planes is running around 14%. So we're seeing fewer and fewer people. In terms of the ability, the national aviation system is controlled by the federal government. The agency that oversees it is Federal Aviation Administration. So for any reduction in flights or anywhere that would be mandated, they would have to approve all of that. So at this point, there have been no discussions that I'm aware of any restrictions on flights. I know there was some discussion, at least in the media, that President Trump was considering a quarantine of the tri-state area, New York, New Jersey, and Connecticut, but apparently that is not going forward. But I think if I recall, and seeing a brief snippet on Governor DeSantis' press conference, he said he's in conversation with the president on that matter.
So the only people that have control is the federal government, correct?
In terms of the flights.
Yeah. Okay. Thank you.
Okay. Thank you all for being here this afternoon. Just the final takeaway from this is that given the data that Dr. Pino talked about that they're receiving from the Department of Health, many of the cases that are currently being confirmed are confirmed based upon individuals who are here locally or who have contracted the virus here. So it remains very important that we continue to practice the social distancing and adhere to the various orders that we have put in place to stop the virus here and the spread of it within our community. So thank you. We will likely come to you again in the near future as we get additional information to share with our community. Thank you to the partners who have been here.